State healthcare portals are tracking and leaking your data. Seriously? You're receiving the CyberStream System Update, your daily bite of cyber news. My name is Matt Cordell, and I'm the COO of CyberStreams. We are your neighborhood IT department. Today's update: state healthcare portals are leaking your data. If you've ever used a state healthcare portal to check your Medicaid status or book a clinic visit, you might assume your sensitive health data is locked down tight. Think again. Tech reports reveal state healthcare systems are tracking your clicks and selling your personal info. Why? Because apparently privacy is just a buzzword for some state IT departments. Picture your health data as a diary you thought was securely under your mattress, but your parents kept a spare key and are selling the content to kids at school. State healthcare portals like those for Medicaid in multiple states embed trackers. Think Google Analytics, or worse, that log your clicks, searches, and even diagnoses. These trackers, often from third-party vendors, share data with advertisers or brokers, turning your medical history into a dark web jackpot. California's portal is using 63 trackers, Nevada 49, Maryland 31, Massachusetts 28, Georgia 16, New Mexico, Colorado, New York, and New Jersey 15, Pennsylvania 14, Maine 12, Washington State, Rhode Island, and Idaho 10, Connecticut and Virginia 9, Kentucky 4, Minnesota 2, Vermont 1. It gets worse. The Change Healthcare breach, hitting 190 million Americans, showed how state-linked systems fail. Hackers used stolen credentials on an unprotected Citrix portal, no multi-factor authentication, to steal records, billing info, and social security numbers. States like Massachusetts and New Hampshire issued warnings, noting delays and notifications left users vulnerable. Episource, a vendor for state health plans, leaked 5 million records in 2025, including medical histories, due to a ransomware attack. Georgia's Pineland Community Service Board saw data on 50,000 patients hit the dark web via Ransom Hub. An ex-post from HealthSec Now screams, "States can't secure our data," while Cyberbit calls it gross negligence. Why does this keep happening? Budget cuts, outdated systems, and a "it won't happen to us" attitude leave state portals as sitting ducks. Vendors like Episource or Change Healthcare, handling massive data sets, skimp on basics like MFA or encryption. States, stretched thin, don't audit these partners, letting trackers and leaks slip through. Your health data, names, diagnoses, insurance details, ends up on dark web forums, fueling identity theft or fraud. If you use these portals for checkups or benefits, your privacy is at risk. At CyberStreams, we're fed up with these lapses and here to help lock down your digital diary. I've put together 3 takeaways and next steps. First, block trackers. Browse with a VPN or tracker blocking browser like Safari, or a browser extension like DuckDuckGo to shield your data from trackers. Second, use data removal services like Cloaked, DuckDuckGo Privacy Pro, or Delete Me to remove your info from data brokers. And third, demand better privacy. Push state agencies to ditch trackers and insecure portals. For more on staying secure, click the link in the comments or email me at matt@cyberstreams.com. This concludes your CyberStream System Update, and this is Matt Cordell signing off.